Jacobsen. Hypnosis has been helping people for a very long time, and I'm well aware of its medical applications. How can the Gastric Mind Pass program help people lose weight?
Well, the first thing you have to realize is when you're using hypnosis cannot help anyone lose weight. I know you've heard of hundreds of thousands of people that have used hypnosis to lose weight. It's not exactly true. Hypnosis doesn't help people lose weight. Hypnosis is a clinical, medical, motivational tool that you can use to program your brain to get you to consistently, happily start doing everything you know you should be doing to reduce your weight, but you're not doing it. Now, on the other hand, though, hypnosis is a clinical, medical, motivational tool that you can use to program your brain to get you to consistently, happily stop doing what we know we should stop doing, but for some reason we don't. And every time we cheat and pick, we feel guilty about it. So the Mind Pass program is a powerful program that includes not only hypnotherapy, but NLP, neuro-linguistic programming, behavior modification, sensory visual imagery, and the goal is to literally convince the human mind, that it has actually had either lap band surgery, bariatric surgery, or gastric bypass, to trick the brain, to convince the brain, to convince the unconscious that the surgery occurred at a deep hypnotic level. And when that takes place in the human unconscious, in the human mind, the people start to act as if their stomach is smaller. As a result, they eat less, they're satisfied with less, and they start to lose weight. They eat better, they're more motivated to exercise because of the subconscious information we implant during the program. They're more motivated to take care of themselves and do the necessary things or the required things to keep the weight off permanently. It's a very, very powerful tool. But if you don't mind, I just want to say one other thing real fast. About 13 years ago, maybe even more than that, I started to work at Lourdes Medical Center in Philly, in New Jersey, and was working with weight loss patients, gastric and bariatric. And I had a very interesting thing happen. Working with these patients after this very invasive surgery, I noticed that they started to gain their weight back. After the surgery, they're gaining their weight back. And I came to the conclusion that the surgery only took care of the body, only took care of the physical problem. It didn't take care of the mental. So there's a real secret in weight loss, and the secret is that you need to lose weight twice. If you want to be successful with weight loss, you must lose weight twice, once mentally and once physically. So these people are having this surgery, which, by the way, I believe for some people is very valuable. These people are having this surgery, but it's only taking care of the physical part. It's not taking care of the mental. So after the surgery, they're going home and making the same exact mistakes that they were making that caused the weight to come on to begin with. So you need mental surgery also, mental surgery. You need to change the internal habits. When you change the habits, and if the habits are changed permanently, which is the goal of the Gastric Mind Pass program, with permanent behavior modification, the weight stays off. And the highlight is, by the way, I'm sorry to interrupt you. The highlight is there are no side effects, none. If this program doesn't help you, the very worst that will happen to you is nothing. No side effects, no high cost of the actual surgery, which could be up to $30,000. No recovery time. Right after the program, people can, go right back to work or get back involved in their daily activities. It's fun, it's easy, it's effective, it's cost effective, and it solves problems.
Well, my next question was, is this safe?
Well, because the surgery is done in the comfort of the patient's mind, it's totally safe. Again, there are no side effects with hypnosis. The worst that will happen to you if it doesn't help you is nothing. The surgery is all done in the comfort of their own mind. It's an imaginary subjective process. And because it's an imaginary subjective process, there are no side effects whatsoever. And again, the goal of the program is one simple thing: to convince the mind that it had the surgery.
Right.
So that the person will start to eat less, eat better, eat healthier, and do all of the necessary things required to keep the weight off. It's a permanent lifestyle change. And the people, it's amazing, and the people really, really enjoy it. I've been doing this now, the actual surgery program, the mental surgery program, it's going on 11 years. and tremendous success with it, and a lot of fun.
How long does the process take?
If it's done the way I like to do it,
Right.
because people sometimes have crazy schedules, but and we try to accommodate people's schedules. But if we do it the way I like it, it's a 10-hour process, 10 hours of training, 2 hours a week for 5 weeks. And each section, each week, prepares you for the week to come. And each process builds on the prior process. And as a result, the final outcome is complete and total life mastery and behavior modification.
So it's literally 2 hours a week.
The way I like to do it is 2 hours a week for 5 weeks.
Okay.
We do anything we can to accommodate people's schedules. Some people like long weekends, 4 days in a row. We've done that, tremendous success.
Okay.
We've also had some people that wanted to do the entire training in one day, which is just a complete 10-hour training. It works, very effective. I just don't like doing it that way. I think people need time to digest the information.
Right.
I
Well,
think
that
it
makes sense, yeah.
Well, I just think it makes a greater impact.